Sometimes problematic substance use and substance use disorders present in a context where longer-term care just isn't possible at that juncture. This could be settings-based, say this is identified in an emergency department, for example, or in a local community center where they can only do brief sessions with someone, or it may be time-dependent. Although in some instances, someone who may identify that there is substance use related risk or substance use disorders may not have the clinical training to exactly treat that person, or at least treat that person in a long-term comprehensive context. So in this context, there are many brief interventions. And today I just kind of want to highlight this concept called SBIRT. SBIRT, SBIRT. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. The screening part is to identify whether or not there is a risk of problematic substance use or someone developing problematic substance use, or if there is some sort of risk there, or if that person does meet some sort of criteria for a substance use disorder. Sometimes screeners will be used, which are brief questionnaires that allow someone to identify whether or not they meet the specific risk. So one example is this screener called the Audit, AUDIT, or Audit C, which identifies whether or not someone may be at risk for problematic alcohol consumption. And so that's the screening piece, screening this person for potential problematic substance use. Then there's the brief intervention piece. Now, the brief intervention piece is typically just a discussion back and forth where it's non-judgmental and someone is relaying potential risks of that person using the substance in the way that they're using it, or describing potential risks of having a condition related to substance use. So substance use disorders, for example. So essentially relaying the risks and harms, sometimes providing education. And again, this needs to be non-judgmental and focus more on a standpoint of reducing harms and educating. Then there's the referral to treatment piece. Now, this piece is extremely essential because what happens now is, now that you've screened and you've identified that someone is at risk of having or eventually developing a substance use related condition. So once you screen for it, you do the brief intervention. So you're identifying and explaining some of the risks and harms. Now, the referral to treatment piece is extremely important because you're highlighting potential avenues for this person to seek longer-term care and longer-term treatment. Say they have a substance use disorder that merits potential outpatient treatment, referring them to outpatient treatment. Or say this person has a substance use disorder that would be better treated in a residential setting, and they have other social context issues that may make residential treatment better, then you may refer them to a residential treatment program. So ultimately, SBIRT is a tool that's used when time is short, but you want to ensure that you screen someone for potential problematic substance use. You want to provide a very rapid, very quick intervention, and then also refer them to treatment for longer term care. I hope that someone out there will find this video useful, and thank you so much for watching. Thank you.